Welcome to Week 5 presentation, Endocrine, Nutritional, Metabolic Diseases, and Immunity Diseases. This is Dr. Regina Glenn, and I will be hosting this presentation. When we think about endocrine, metabolic, and nutritional disorders, usually the first thing that comes to mind is diabetes. There are two major types of diabetes, type 1 and type 2. Type 1 diabetes is also referred to as juvenile diabetes. These patients require insulin to live. Type 2 diabetes is also referred to as adult onset diabetes, or AODM. This type of diabetes may or may not require the use of insulin. This type of patient may be documented as IRDM, insulin-requiring diabetes, or IDDM, insulin-dependent diabetes. If a patient is on insulin, a second code for long-term insulin, or Z79.5, should be assigned. Patients with diabetes may develop complications due to their diabetes. The linkage between the complication and the diabetes must be stated by the physician. Linkage statements include diabetic retinopathy, diabetes with neuropathy, or nephropathy due to diabetes. Just the fact that the patient has both diabetes and a secondary condition does not mean that the condition is due to the diabetes. In order to code a diabetic complication, the linkage between the conditions must be clearly stated by a physician. Diabetes can occur only during pregnancy. Diabetes that does occur only during pregnancy is referred to as gestational diabetes. Gestational diabetes is coded to the subcategory O24.4 with the additional appropriate characters. Pregnant ladies who had diabetes prior to becoming pregnant are coded to pre-existing diabetes in pregnancy. Pre-existing diabetes is coded based on the type of diabetes to subcategories O24.0, O24.1, or O24.3 with the appropriate additional characters. Syndrome of infant of diabetic mother is assigned to a newborn whose mother was diabetic during pregnancy and who shows manifestations or requires treatment. There are two types of secondary diabetes. Category E08 is used for diabetes due to underlying conditions such as cystic fibrosis or a neoplasm of the pancreas. Category E09 is assigned to diabetes due to a drug or chemical such as an adverse effect or poisoning. One common complication of diabetes is hypoglycemia. Each type of diabetes has a unique hypoglycemic code. An example would be for type 2 diabetes with hypoglycemia, assign code E11.649. A couple of nutritional diagnoses are obesity and malnutrition. These conditions cannot be coded without physician documentation of the diagnosis. Obesity can be classified as overweight, morbid, or unspecified. Again, the physician must state the type, such as morbid, obesity. A coder cannot look at the patient's weight or BMI and assume the condition. There are many different types of malnutrition that may be assigned based on physician documentation as to the severity of the malnutrition. For both obesity and malnutrition, assign the BMI, if documented. Do not code the BMI unless a diagnosis of obesity or malnutrition is given. The BMI is an additional code to be assigned. The official coding guidelines does state that the BMI measure may be taken from ancillary care documentation and does not need to be documented by the physician. This means that the BMI may be taken from the nursing notes or nutritional notes. However, the condition, obesity or malnutrition, must first be documented by the physician. This is the end of the presentation on endocrine, nutritional, metabolic diseases, and immunity disorders. If you have any questions, please contact your instructor.